Topic 1 addresses the mission and key principles of early intervention. In this topic, we discuss information for practitioners working in Part C of the Individuals with Disabilities Education Act, and particularly talk about issues that are specific to early intervention, as opposed to services that might be provided in a pediatric clinic or in a hospital-based setting. Several years ago, the Office of Special Education Programs, OSEP, asked the National Early Childhood Technical Assistance Center, NECTAC, to develop guidance documents for early interventionists working in natural environments. The work group was comprised of family members, faculty members, researchers, administrators, service coordinators, and individuals representing the major disciplines involved in early intervention. Important to note in the mission is the focus on early interventionist support of family members and care providers to enhance child's learning and development through everyday learning opportunities.
The work group identified 7 key principles for implementing early intervention services in natural environments. Research tells us that all young children learn through participation in everyday life activities with the people that are important to them. Therefore, key principle number 1 relates directly to use of everyday opportunities as learning experiences for infants and toddlers with disabilities. For more information about this key principle, the mission, and the key principles to follow, see the link on this page. Research indicates that all families can contribute to their children's learning. All families means families of various socioeconomic status, families with varying levels of education, families with mental health issues, and families with other challenging situations. But key words in this principle are necessary supports and resources, which would include early intervention practitioners as resources, as well as other supports that might be available to families within their communities. Key principle number 3 emphasizes that the role of the service provider in early intervention is to work closely with the parents and other important people in the child's life to support them in enhancing the child's learning within and across everyday routines and activities, rather than the service provider only working directly with the child. The reason for this key principle is because care providers and families are with the child many more hours than possible for the early intervention provider. Therefore, it's important that they know how to support and sustain the child's learning within and across everyday activity settings to maximize the benefits of interactions with the young child.
The fourth key principle is about the early intervention process, and more specifically, it's about individualizing this process for all families, making sure that we're taking into account their culture, their individual learning styles, even things like meeting with them at times and locations that are convenient for them. This process must be individualized from the very beginning, from intake and referral, all the way through transition. This key principle focuses on the individualized family service plan, particularly writing outcomes that are based on family's priorities and functional aspects of the child's and family's lives. For example, we might have an outcome about Joey's family feeling comfortable giving him his bath, or Sissy enjoying mealtime with her family. These are just a few examples, and we'll revisit this in more detail in Topic 3. Key Principle 6 reinforces the information that we have from research and best practice, indicating that in early intervention, the child's and family's needs are best met by a primary service provider. We'll go into more detail about this in Topic 4, where we'll discuss the characteristics of the practice, information from research, and begin discussing implementation for using a primary service provider approach to teaming.
The final key principle emphasizes that in addition to the laws and regulations under Part C of IDEA, we need to be using evidence-based practices. Quite simply put, evidence-based practices are practices that are based on research and should be available from each of our disciplines to guide us in terms of the interventions that we would use with a particular child and family. So we should be using practices that are based on evidence rather than solely our personal preference in the way that we would interact with a child and family. The early childhood literature has a number of excellent definitions for evidence-based practices. The definition you have on your screen is from the federally funded Research and Training Center on Evidence-Based Practices in Early Childhood, which emphasizes the importance of the characteristics of a particular practice that would then lead to the intended and desirable consequences. For each of the areas that we will be talking about in upcoming topics, which would include natural learning environment practices, coaching as an interaction style for working with adults in the child's life, and primary service provider approach to teaming, we will be starting with the characteristics of the practice based on the research which are used to define and implement it. Sometimes early intervention practitioners have questions about whether it's appropriate to provide services and supports in natural environments, use a primary service provider approach to teaming, and use coaching as an interaction style when working with important adults in a child's life. What does your professional association say about providing services and supports in natural environments? Take a few minutes and jot down your current knowledge of information from your professional association or documents that have been printed by your professional association related to your responsibilities and roles in early intervention. The American Speech-Language Hearing Association has a number of documents published on their website related to the roles and responsibilities of speech-language pathologists in early intervention. You may access these documents by following the link on this page. The information contained in the documents and the information that you will review in these topics are consistent. We invite you to explore this link and obtain more information from the American Speech-Language Hearing Association. The American Speech-Language Hearing Association also published an article in the ASHA Leader by Dr. Julianne Woods, which explains further about the roles and responsibilities of speech-language pathologists in early intervention and addresses the documents that ASHA now has available up on their website. Within this article, Dr. Woods references the fipcase.org website, which we also are referencing within the topics in this module for further information. You'll find those links on upcoming pages.
The American Physical Therapy Association also provides information for physical therapists working in early intervention. In 2004, the Physical Therapy magazine published an article on specifically the role of the physical therapist in early intervention. On the section on pediatrics website, there are several articles that are helpful for early intervention practitioners. One is about natural learning environments, and the article listed here is about team-based service delivery approaches and talks specifically about using a primary service provider. We hope that you'll visit the site to get more information. The American Occupational Therapy Association provides a host of resources for occupational therapists working with infants and toddlers. One we'd like to draw your attention to is this one by Pilkington in 2006. It talks in detail about using a primary service provider and working in natural environments.
The Division of Early Childhood of the Council for Exceptional Children is the professional association for all early intervention practitioners across the country, but in particular, early childhood special educators. DEC has a number of different documents related to working with infants and toddlers in natural environments, and in particular has a 2005 text, which is the DEC Recommended Practice Guide. This guide specifically talks about teaming approaches, as well as IFSP development, evaluation and assessment, and several other topics that will be covered in this module.
Now that you've reviewed the mission and key principles for providing early intervention services in natural environments and the information from your professional organization's websites, we'd like you to take a few minutes and jot down some notes about some questions we'd like you to think about. The first question is, how is the information you reviewed from your discipline consistent with how you currently practice? Second on our list, what changes do you need to make in your practices to be more consistent? And finally, what supports do you need in order to align your practices with the mission, key principles, and information provided from your professional organization? After you've completed these questions, take some time and sit down with your early intervention coordinator or another member of your team and discuss your thoughts. See if you've generated any other questions for your team or coordinator to consider. You've now completed Topic 1. When you're ready, please move on to Topic 2, Evaluation and Assessment.